Vertebroplasty. Vertebroplasty is a minimally invasive outpatient procedure performed to treat compression fractures of the spine. It can also be used as a method for treating tumor-related bone pain. Vertebroplasty is a procedure during which a needle is placed into the collapsed vertebral body under fluoroscopic guidance. Once the position is confirmed, special bone cement is injected into the collapsed vertebral body, thereby stabilizing the fracture. Kyphoplasty. Kyphoplasty is a minimally invasive spinal procedure very similar to vertebroplasty, used to treat painful compression fractures. Kyphoplasty, much like vertebroplasty, is a procedure which involves needle placement into the collapsed vertebral body under fluoroscopic guidance. During kyphoplasty, 2 needles are placed, one on each side of the compressed bone. Through these needles, special balloons are placed into the vertebral body. These balloons are then inflated, potentially restoring some of the height and original shape of the compressed vertebral body. The balloons are then deflated and removed. The cavity created by those balloons is then filled by injecting bone cement. This strengthens the vertebral body and stabilizes the fracture. Preparation. For both vertebroplasty and kyphoplasty, patients are positioned on their abdomens, leaving their backs exposed. IV sedation and pain medications are given to ease patient anxiety and alleviate any procedure-related pain, but patients remain awake. Because of the use of these medications, patients are asked to not eat or drink anything for 4 hours prior to the procedure. During the procedure, the collapsed vertebral body is viewed under fluoroscopy or X-ray. The skin on the patient's back is cleaned with antiseptic solution and a sterile field created. The skin is then numbed with injection of a local anesthetic. Through the numb skin site, the needles are placed through the skin into the collapsed vertebral body. After cement has been injected, the needles are removed and a bandage applied. The procedure typically takes around 1 hour. The cement hardens in approximately 20 minutes. After the procedure, patients are sent to a recovery area and typically return home within a couple of hours, and can return to normal activity within a day or 2. The occurrence of a vertebral compression fracture, either due to osteoporosis or another case, puts a patient at increased risk of developing other fractures at other levels of the spine. Bone strengthening medications may be given by the primary care provider. If additional vertebral bodies collapse, kyphoplasty or vertebroplasty can be performed to treat the other levels. The radiologist will help determine whether kyphoplasty or vertebroplasty would be most beneficial in each individual case. In the first 24 hours following a vertebroplasty or a kyphoplasty procedure, plan to rest and not to drive. Some soreness at the injection sites is to be expected, but this pain should diminish over the next several days. Valley Radiologists is pleased to offer pain management procedures at Valley Medical Center and Auburn Diagnostic Imaging Services. These interventional radiology procedures are very specialized imaging studies. Only select radiologists have undergone extensive training and further education to perform spinal injections. A nurse practitioner is also available to you before and after your procedure to answer any questions. After your procedure, your physician receives very detailed images and a written report outlining what was performed and diagnostic results. Please call us at 425-251-5173 in Renton or 253-395-1955 in Auburn if you have further questions or would like scheduling information. We look forward to serving you and your physician with the best in service and imaging.